I'm Doug Whalen. I'm a linguist. I don't know if I'm pettable or not. I guess we can find that out later. But I do, in fact, have kind of three major hats that I wear. The first one is my main appointment at the Graduate Center of the City University of New York, where I'm primarily in speech-language hearing sciences, but also in linguistics. I'm a phonetician, so I deal with just the sounds of languages, and sometimes it's useful and sometimes it's not. I always think it's fun. Not everybody agrees with me. I wanted to just kind of point out some progress that we're making. So I currently have one native student, which is one more than I've had in the past. So that's some kind of progress. She's one of the co-authors on the paper that I'll be describing today, and she's also a teacher of the Shawnee language. So that's strand number one. Strand number two is I'm also at the Yale Child Study Center, which has now absorbed Haskins Laboratories, which was in New Haven and is now just part of the Child Study Center. I'm also adjunct faculty with the linguistics department, and the linguistics department at Yale has just hired Patrick Del Percio to teach Cherokee as an official class. So this is the first Yale official full credit class in an indigenous language. So that's some kind of progress too, I think. And then my third hat, which is the one that I'm here mostly under, is as founder and chair of the board of the Endangered Language Fund. And this is an organization that has similar goals to ILI. ILI got a 3 or 4 year head start on us, but it's been gratifying that we both continued to keep doing the work all these years. The Endangered Language Fund primarily gives grants to people to continue their work. Over the years, we've evolved into providing a lot of support for revitalization, because if you're doing revitalization, it seems like it comes down to either the ANA, if you have a lot of perseverance, or the Endangered Language Fund, if you have a very small project, because we do not have as much money as the ANA. So it's something that I think continues to grow. We keep having more success. And so if you have a small project that would be helped out by a small amount of money, consider applying for one of our grants. Dr. Littlebear wanted us to all tell a joke. I'm a little reluctant to tell this joke. Not because it makes fun of linguists. Linguists are fun to make fun of, but because you all probably have told this joke already yourself, so it's just kind of a rehash of it. So one community member is talking to another, and he says, "This linguist showed up 2 weeks ago, and he's telling us stuff about our language." And so that's the joke. I have to explain that was the punchline there. As a linguist, I like the people who tell this joke and add a little bit more, where they say, "and he's right." So I like to think that linguists have a bit of use, and we'll see how that works out. I will say that I just a month ago in the extremely non-indigenous city of Prague presented some data on Arapaho. And if anybody is really interested in the phonetics of Arapaho, I can tell you about that later. I was writing this presentation based on a paper mostly that there were several of us on, but I was hoping to be able to co-present with Melissa Lewis, who's from the Cherokee Nation and University of Missouri, but she was unable to fit it into her schedule. So I promised her that I would mangle her part of the review for her. So a lot of the Cherokee stuff is stuff that I don't know particularly well. Okay, so I think everybody here is involved in language revitalization, so I don't need to tell you too much about it. But of course, many tribes and an increasing number of tribes are beginning to revitalize their language. So looking towards the next 50 years, we can really think about what it is that's going to be important for the success of this kind of revitalization effort. As you know, many tribal members not only are interested in language, but many of them are also addressing health disparities, of which there are many, and I think that's also very familiar to people. So we are going to look at one aspect of language revitalization that is often overlooked, and that is health. So one of the ways that I think everybody, again, is familiar with that we ended up with these health disparities was colonization, historical trauma, interpersonal trauma, all imposed over the decades and centuries. Becoming disconnected from cultural lifeways, generally not by choice, trauma, and racism and discrimination, which, as mentioned, continue to this day. And this all leads to distress, illness, mental health, interpersonal relationships, and physical health. So it's an issue that goes up and down the board. So some years ago, in 2016, we published a language on healing through language. And in that paper, we pointed out that communities do not take on revitalization so that languages continue for the amusements of linguists like myself. We do, in fact, love every language. Every language is really interesting. But that's not why people revitalize languages. They do it to heal their communities. They want to bring their communities back together again, to reinstate a sense of pride in their community, and to allow people to become a larger part of the community at large. And of course, to a certain extent, in these days with the large diaspora population, it's even more important. So in our previous review, we did what I call a review of convenience. Namely, I scoured the literature to the extent I could, with some exclusions, trying to find published medical reports of links between maintaining or revitalizing a language and health. In that paper, we focused on physical health. That was largely for my own mental health, because I felt like if I had included mental health, then there would be too many papers and I wouldn't get done. So that came out with myself, Margaret Moss, and Darrell Baldwin as authors. It's in this unusual journal, F1000 Research, which publishes first and peer reviews later. For those of you in the academic world, that might mean something. And it has been downloaded almost 2,000 times across the various places where it's available. This is, I don't know, probably 10 times as much as all my other papers put together. And I was fortunate enough to be able to present it at a similar conference in 2018, at least that was in A's memory. I couldn't track down the date myself. So we, as authors, were definitely pleased that it resonated with people, but it really was not an adequate review. When I did the paper I'm going to talk about, I was kind of shocked to discover that we had only ended up with 9 real studies in the previous paper. And the reason that it never passed peer review was that the reviewers basically wanted us to do a systematic review. And this probably does not mean that much to too many people, but a systematic review is one that goes through a literature with very predetermined search terms and expectations. And it was designed for the medical literature where you have hundreds of papers on every topic. Well, this is an emerging topic and there just aren't hundreds of papers. So we knew we couldn't do a systematic review. So we just never went to the next step with that journal. But within that paper, we did find some solid results. I mean, I'm putting this under mental because that's kind of where we ended up, but the report from Whalen et al. That many of you I'm sure are familiar with, showing that in Canada at least, the higher the proportion of language spoken, the lower the suicide rate. There were socio-ecological improvements in Australia, for example, several reduced risk factors for such things as excessive alcohol consumption, drug use, and being a victim of violence. That one was actually quite interesting, that it was not whether or not they committed violence, but whether they were victimized by violence. And of course, in Hawaii, there are higher graduation rates for those who are learning their language. And this may not strike everybody as a health outcome, but it is one that the National Institutes of Health consider a health outcome. So that's something else that's a straightforward and solid result. I did talk to Pila Wilson because I was a little concerned that the people that were in the immersion schools were doing it by choice, but he assured me that it was still the case that everybody who could afford private school was going to private school. So it really was not the kind of self-selection that would just give you this big boost. It really was legitimate to compare these people to other Native Hawaiians. And then various reports have also shown physical improvements. So in Hopi, speaking Hopi put more people into the good category of health. And then one of the more startling ones was the report by Oster et al. That in Canada, speakers of native languages had lower rates of diabetes, which of course is a scourge that is very hard to avoid. So these were all extremely positive and important results. But we needed to do more because there were various, as I said, drawbacks to this paper. I was fortunate enough to have Melissa Lewis, Stephanie Gilson, Brittany McBeath, Bree Alexander, and our librarian, Kate Nyhan, work on our new version of this topic. And in the 6 years since the previous paper, a couple of things have changed. First of all, as you might imagine, there are more studies. 6 years have gone by. And this time we included mental health because it made more sense. And then for the review itself, there was a new format that had really gained traction in the 6 years called a realist review. So a systematic review, as I said, has really rigid formats that you have to follow. A realist review is much looser, and it depends a lot on citation chaining. So which papers are cited, which papers do they cite, and going in both directions, you end up being able to find things that you would not find just by search terms alone. So I know this is an unfamiliar concept to most people, so I wanted to quote the originators of this, Pawson et al., 2005, because it really resonates with, I think, what we need to do to make use of the kind of results that I'm talking about today. So realist review does not provide simple answer to complex questions. I think we got one of the most complex questions around. It will not tell policymakers or managers whether something works or not, but will provide the policy and practice community with the kind of rich, detailed, and highly practical understanding of complex social interventions, which is likely to be of much more use to them when planning and implementing programs at a national or regional level. So this is something where you should not turn to this paper looking to see, what language program is going to affect which disease. It's something that will give you a sense of what's going on in the published medical literature so that you can make progress beyond that. We were looking for effects of language maintenance and revitalization on reducing health disparities. Again, we use citation chaining. We limited ourselves to the Americas, Australia, and New Zealand. There are several studies in Europe that are of interest, but Europe has fortunately for them, fewer or smaller health disparities, so it didn't seem worthwhile to try to include those studies. There's very little on this topic in Asia and Africa to begin with, so it didn't really seem worth including them as well. There's a lot more activity in these areas that we did look at. So with all these citation chaining and keyword searches, we ended up with 3,060 possible articles. We did not read them all. The first thing that you do in one of these studies is you just look at the titles and maybe the abstracts to determine whether the articles are relevant or not. I didn't put the intermediate step, but that whittled it down to another 250 or so. And then we read those articles and two of us would decide whether it was truly relevant or not. And we ended up with 130 publications that met our criteria. I was disappointed that two of the original articles we cited didn't make it. One of them didn't even make the list of 3,000 because you really had to dig deep in that article to know that it was happening. And it turns out that even for more straightforward topics, it's typically the case that you see 2 to 5% of things that are missed. Anyway, so we classified the results of these studies. Some of the papers had more than one study. And we just went with these overall categories. General can be things like, do you feel healthier? Because many of our self-reports were things like that. Education, which I already mentioned, drugs and alcohol we threw together, diabetes, obesity, tobacco use. Tobacco use is quite complicated because many of the reports just talk about tobacco use and don't sort out whether it's actually, just plain old everyday cigarette smoking or if it's traditional use of tobacco, which can be quite different. Suicide, mental health, crime, and other. The other was quite disparate. And so then we classified these by whether they were quantitative, that is, did they do some number assessment of the proportion of the different populations and possible differences in health. Qualitative, where it was just a report of interviews or whatever. And then whether the results were positive. Oh, sorry, I forgot to move this forward. So, and then we classify the results as positive, negative, or neutral. And sometimes this was a little bit challenging because there might be, several different aspects within one study, and so it could have gone in multiple directions. So that, there are ways in which this data can be looked at more carefully. The papers that we looked at are all cited in the article, so if you really want to delve deeper into any one of them, you're welcome to. So here's a figure that shows this graphically. So basically the blue results are the number of studies that were positive, orange is neutral, and gray is negative. And this goes by those various categories, general down to other. And as you see, in most cases, the blue bar is higher than the other bars. And many times the neutral and negative are pretty much similar. Tobacco, partly because of this issue I mentioned, is one of the cases where there's negative. The other was quite difficult to interpret, so I'm not sure how seriously to take that. But if we just look across all the studies, the positive outcomes were 61.8% of those outcomes. Neutral and negative pretty much split the other two evenly. And if we look at, if we combine mental health and suicide, that's where we really saw our strongest results, with 78.9% of the studies showing a positive effect. And of course, given the crisis in suicide, this was quite heartening. We looked at what was possibly accounting for some of the negative results, and in fact, many of those were associated more with poverty and low socioeconomic status. But what was also interesting was that the populations that had the positive outcomes often had the same level of poverty. To us, this just means even more strongly that those positive outcomes are pretty impressive, because they were overcoming the same level of poverty that was causing some negative results for other studies. Some other issues, more specifically about the education side. Many of those measures are actually not in the indigenous language, as you might expect. These are measures from the schools that are being taught in the locally dominant language, for us mostly English and Spanish. On the one hand, this seems kind of unfair, and we considered taking it away, but on the other hand, as I mentioned, for the Hawaiian, it actually was extremely positive outcome. So it is kind of an interesting mixture of effects. Many of the negative results were in Mexico, where it seemed like there was a great deal of just outright discrimination within the classroom against indigenous language speakers. So anyway, it does seem that it depends on the local situation. As we know, every language has a unique situation, so it's hard to apply all these results broadly, but in general, we found these positive results in education and the other categories. So because most of these publications were in mainstream medical journals, they either just intrinsically assumed Western definitions of health, or weren't able to overcome the editors and provide a native definition of health. And you know, this is something that is one thing that we deal with all the time, living in this particular time and era, that you have to succumb to a bunch of definitions and attitudes that you don't necessarily agree with. It was interesting to discover that the World Health Organization does include the statement, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which is closer to native definitions of health than I expected from the World Health Organization. But even more drilling down a little bit deeper into native definitions, there are a lot of issues about being holistic, biosocial, spiritual, interconnectedness with family and community shows up even more prominently than, say, in that World Health Organization. Darrell Baldwin has a nice description of this from a Miamia perspective. So that he emphasizes that it includes living well and properly, having awareness, wisdom, and knowledge, not your everyday definition of health. The Pueblo Convention, or Convocation rather, some of whose members may be here, I'm not sure, reported that one of the goals of the convocation was to encourage Pueblo people to think about health beyond current limited associations with physical health, illness, and seeking medical care at a local Indian health service facility. And summarizing it in points that were similar to the ones that the Miamia situation brought up: spirituality, community, family and children, physical health, traditional foods, which is of course becoming far more prominent these days, hard work, not something that many people talk about these days, and breastfeeding. There was also a survey that was done by Joe Gahn and some of his colleagues. The natural elements, songs, prayers, and holy sites were provided by the Creator, and relying on them is vital to the healing process. Without the proper protocol, ceremony, these elements are not in their full power. Traditional healing occurs when one is determined to be healthy. So some of the implications of these definitions are that the connection to community is really important, and indeed that is the primary thing that we assume is happening with language revitalization, was that it really improves your connection to your community in a very direct way. And as we know, learning a language really instills the language's worldview without any further effort. That, simply learning how to say things suddenly makes you see the world in a different way, because you have to pay attention to different things to say it in the indigenous language. So I do like to always point out that not every revitalization effort is seeking full fluency. Having full fluency is wonderful when you can achieve it. Not every community can do that, certainly not in the near term. Perhaps 50 years from now they will be able to. But many times simply being able to have the community participate in a ceremony is satisfying and also probably promoting health. Again, this notion that the language is telling you something about your worldview is often attributed to what we linguists like to call the Sapir-Whorf hypothesis, that language determines your worldview. This strong version has received a lot of pushback, but nonetheless, you can find this quote by Boroditsky. How do we know whether the differences in language create differences in thought or the other way around? The answer, it turns out, is both. The way we think influences the way we speak, but the influence also goes the other way. The past decade, this was 10 years ago already, has seen a host of ingenious demonstrations establishing that language indeed plays a causal role in shaping cognition. Studies have shown that changing how people talk changes how they think. So this filtered into a Cherokee Master Apprentice student that Melissa had interviewed or had noticed being interviewed in the Cherokee Phoenix a couple of years ago. I struggle with mental health disorders like PTSD, and one of the things that happens when you have PTSD is that you have flashbacks. You have circular thoughts, kind of like a vortex. And I only think that Cherokee language helped me process that, because whenever you're thinking in the language, you have to be aware of where you're at and what's going on around you in a way you don't in English. I really think that language has some healing properties in it, because I really don't struggle with those problems like I used to. So the mechanisms for the effects that we are reporting from these articles is something that is intuitively obvious to some people and rather difficult to completely nail down for the more clinically inclined. So this is where Melissa would really have taken over, because many of these things are things that she wrote for me that are not ones that I can do. I still don't read the syllabary after all these years, even after having Durbin Feeling on my board of directors at the beginning of the Endangered Language Fund. We all have our limitations. But depression is actually a word that mostly means thinking back towards yourself. And that puts a very different spin on it from just thinking of depression as a reaction to bad effects. Historical trauma is translated as the heart, and therefore thoughts is crippled. This led Melissa to start studying master-apprentice relationships more carefully. She was collecting some anecdotal data. Again, this is qualitative data because she's not measuring things statistically. Looking at the master-apprentice program and looking at various aspects of the health evaluations. This brought her, sadly, face-to-face with the funding issue. Getting these studies done is not free, neither is language revitalization itself. It actually is not terribly expensive either, partly because we're amazingly dedicated, and we put up with a lot of being underpaid. Most programs that I'm familiar with are funded by the culture or education program of their tribe, and I truly believe that this undersells language revitalization. If language revitalization has positive health benefits, it should be classified as a health program. And if we look at it that way, we can see also that there's a great disparity in the funding that should be available. So my next slide is going to show just some proxies for funding. For culture, I picked the National Endowment for the Humanities, and for health, I picked the National Institutes of Health. This was because when I tried to really find out how much was being spent, it turned out to be completely impossible. I think not just for me, I think it would be impossible for anybody. So these may or may not be the best proxies, but I think the overall effect is actually quite true. So here's the budget for the National Institutes of Health, and if you squint, you can see the funding for the National Endowment for the Humanities. And this is pretty typical for culture versus health. People are quite naturally wanting to be healthy, so spending on health gets a lot of priority. Like any time you're spending a lot of money, a lot of it gets wasted, and I think that we could redress this balance and start spending more money on health, on language revitalization, and see positive outcomes in health. Some of the revitalization programs are running on as little as $5 million a year. I know some of them are running on even less, sometimes zero. But it's very seldom that you see a really expensive language revitalization program. It's easy to find, say, a diabetes program that's costing $5 million a year, and that's addressing a single issue. We have found positive benefits on just about everything from a single program, namely language revitalization. So if you can have the same effect for everything from a single program, why wouldn't you fund it? It is something that makes so much sense to me, and mostly every Native person that I've talked to, that it's been a little hard to understand why it's made so little headway in the actual funding. But I think people are beginning to latch onto it and start thinking in this direction. one of the reasons that I pushed through doing this review was to be able to convince people like NIH that they needed to spend more money in this direction. And we have actually made some progress with the National Institute on Minority Health and Health Disparities. The program officers there were enthusiastic, which program officers at national institutes are part of their job is being supportive of potential applicants. I have yet, in my 40 years of NIH funding, I've never had a program officer before be enthusiastic. So I think this is a really good sign. So because many tribes are now recognizing the usefulness of language revitalization, there are more of them every year. And again, even though we've shown that the effects are positive, that by itself is not really enough. The results are too scattered to do what we scientists like to call a meta-analysis, which would really let us see just how much money would be saved by funding a language program. So there's more research that's needed. Research should not displace the revitalization effort itself. My intent is in any programs that I do that the research will in fact support the revitalization effort directly as well as studying it. There are many tribes, of course, that are leery of being studied at all for understandable reasons. I'm a scientist, I can't help myself, I just like to study things, but I think it also does help convince people who have big budgets to let some of that budget go, because the bigger the budget, the more you want to see that there's proof showing that it's going to do some good to spend it. And despite seeing all these positive effects, we don't really know what's the most effective. I mean, we know, as mentioned, that immersion is the best way to teach the language, but not everybody can do immersion. So if you're not doing immersion, what works best? How long is the effect going to last? And very many other questions. So in particular, once you've started learning the language, if you use it an hour a week, is that enough? Do you have to use it 10 hours a day? Well, I guess none of us probably talk 10 hours a day, well, except for my former sister-in-law. But it's a question that is, I think, relevant to making decisions about how to structure a program. Is one type of program more efficient than another? We know that immersion is really the gold standard, but silver and bronze standards must be out there as well. One that I think is really relevant, particularly in these days of diaspora and just greater technological use by communities throughout the country, is remote usage as protective as in-person? I actually don't know. It could go either way. But there's also the challenging question of should we just teach the culture without the language? It is possible to do cultural practices without the language. My feeling has always been that the language applies to every cultural practice you can think of. So not everybody wants to do basket weaving or canoe building, but they can both learn the language. And of course, as I've mentioned several times, revitalization programs do include cultural revitalization as well, because it just doesn't make sense to do one versus the other. But if culture is enough, should we put in the effort of learning languages? I think everybody here recognizes that learning languages is challenging. It's challenging for some people more than others. Even though I'm a linguist, it's very challenging for me. I'm a miserable language learner. those who can't do teach. So I'm not a very good language learner. So where do we put our efforts? Which one is going to be the best use of our approach? Because it is certainly the case that there are successful examples of direct treatment approaches that don't include language. The Blackfeet Culture Camp is one such example. I think that was run by Joe Gahn. There was a canoe journey that had quite significant outcomes of improved health. The hula program, I think, has also been quite successful in improving health without necessarily including the Hawaiian language. Pima Pride was a study that is in my references, but I no longer remember the details. And then Healthy Roots is another one that did in fact do some quantitative measures of direct health outcomes. So it is possible to have these benefits, and I think that's wonderful, particularly for any group that just doesn't feel like they can tackle the issue of language revitalization. I would like to think that language adds something in addition, but as we like to say as scientists, it's an empirical question, and I do in fact hope to get to study this. So again, some of the programs that Melissa Lewis has been involved in include the Remember the Removal program, which has been going on for quite a while. She studied a more recent, so this is a bicycle trip from the traditional homelands of the Cherokee to the removal site in Oklahoma. And the more recent additions have included 4 months of taking classes about history, culture, and language, and personalized genealogy, and then 4 months of doing some rides to get in shape for it, and then 3 weeks for a 950-mile bicycle trip from Carolina to Oklahoma, and including history lessons and Cherokee cultural knowledge along the way. You can't really read this, but looks nice. But there is a culture-based curriculum at the Cherokee Nation that is, as you can see, fairly extensive. This is a map showing, as I said, this has been going on, I believe, for 20 years or so, these bike rides. And so they've taken various parts of the Trail of Tears, the northern part and the southern part, and starting from various places within the Carolinas, and always ending up in northeastern Oklahoma. Melissa's study took many years to conclude. Even research, even though it seems kind of dry and simple, itself has a rather extensive timeline. Melissa has published several papers on this, which includes discussions with focus groups to see what community members really wanted to get out of this program, because what really matters is connecting the community desires to what's attainable with your program. So some of the survey data that she had looked at physical, emotional, social, and cultural issues. She was funded by the Heart and Lung Institute, so she was actually measuring things like blood pressure. And so she had some preliminary studies, but then you won't be able to read all this, but you can see that in the shaded green cells, those are positive, significant in the statistical sense. These are things that really showed up through the noise. And physical health, mental health, and social cultural health had a whole bunch of different aspects that showed improvements just from being in this, about 10-month experience. And this was published in a paper last year by Melissa and her colleagues, which, on the one hand, it's a lot of work to do this kind of study. And she had funding from the National Institutes of Health to do it. And then on the other hand, you look at it and it says, oh, that doesn't look like such an impressive result. And both of those are true. I've had to live with this in my own research where I put in all this effort and then it's like, wait, is that it? But the accumulated effect is something that I think we can rely on. So anyway, I think I already just went through all this, but maybe I'll just read some of this stuff. So this is from the project. We are not simply remembering the past, we are reconnecting and starting again the right way. As a group, we aim to do things the right way, the way our ancestors did. Therefore, we work to decolonize individualistic thoughts and actions and relearn and reclaim our Cherokee values, kinship systems, and life ways. Standing up, starting again the right way includes learning who we are and where we came from and applying these values and principles to our lives today. So again, it's still ongoing. There's still more research to be done. It will wrap up next year. This was ended up with 4 groups of 10 community members each. So the amount of data that was collected was not incredibly extensive, but not incredibly intrusive either. So I think that was another benefit. So that was the Ride to Remember. Melissa has also been involved in the Little Cherokee Seeds program, which is an immersion school for preschool kids. And so like many programs, this is one that does complete immersion. It's Cherokee-centered, activity-based. These are little kids. Activities are good. And they are fortunate enough to have a 260-acre wooded area to do a lot of activities outdoors and also to be land-based. They're growing some traditional foods in their garden. So it's a fairly complete experience. And so here are some of the traditional activities that they've been doing in this. There are too many for us to read, but there are activities that are associated with each of the 4 seasons. And some of them are manipulative, so basket weaving and so forth. And others are interactive with the environment, like picking mulberries. So it's a really well-integrated system. And it's not extensive. Right now she has 5 mothers. Mothers are better than fathers, sorry. They have an average of 2.5 kids each. And they all had either graduated high school or had some college. All of them were citizens of the Cherokee Nation, and they all grew up on the Cherokee Nation reservation. And they all had a grandparent who was a fluent speaker, which is not every tribe's experience, but they also, none of them had a parent who was a fluent speaker. So what's impressive, even with this small number, was that after just 6 months of being in this program, this is the results for the mothers, not the kids, their proficiency went up, which, I guess is not super surprising if you spend all day with your kids talking to them in the language. Understanding went up too. But using the language at home went from 20% to 100%. And that's really impressive. They felt more tribally connected, more knowledgeable about Cherokee ways, and they followed the Cherokee life ways significantly more. I don't know what Melissa was going to say about this. I left it in because it's a really cool looking figure. But it shows various ways in which you can interconnect different activities that are either done by individuals or groups. So this is hunting in individuals, hunting in groups. And there are all sorts of things that connect to that. And it's a really nice figure. So if Melissa was here, she would have more sensible things to say about it. This is back to me now. That was the end of Melissa's part. I do feel like it's important also to kind of manage our expectations. I am convinced of the healing benefits of language use and revitalization, but I'm not unrealistic enough to think that it's just a miracle and that if you start speaking your language, you're never going to be sick again. That's not the way humans work. But having a significant improvement in your health is always worthwhile. There are still, as I said, I mean, I'm a scientist, I can't help myself. There are all sorts of questions that are still unanswered. We see these effects. How long do they last? If we follow people out 20 years, are the effects still going to be there? It's very hard to tell from the studies that we looked at. Sometimes you couldn't even tell how old the people were that were being reported on. But there are indeed suggestions, perhaps not proof, that full fluency is not required to see benefits. So I think this really gives encouragement to people who do not have the time or the energy to become fully fluent. If they feel like they could benefit from some language use and some language instruction, I think that's extremely promising, personally. But again, I'm a scientist. I'd really like to study this, so we would know, if taking a language class for 2 weeks is all you need, that would be great. I kind of doubt it, but it's something that has never been studied. So what's going to happen in the next 50 years? Like in I won't be around to see it, but I am an optimist, and I do think that the dozens of active language programs will be continuing. Language revitalization is hard. I think everybody recognizes that. But it's hard and rewarding. And I think that because more and more communities are doing it, that there's every reason to think that 50 years from now, we will have been even more successful than we are right now. Funding ideally would be stable, and I believe that treating language programs as health programs is one avenue for making this funding more stable. I think it's unlikely that any community will be completely monolingual. It would be wonderful to be able to spend time in a community where the language was the only one being used, but it's not going to be the norm. That's just the way the modern world is. And bilingualism has some benefits anyway. 50 years from now, people who are speaking their indigenous language will, in all likelihood, be bilingual in some other language. So I think it's definitely worth doing that. I don't think we have to strive for monolingualism, but having healthy native languages is a important goal, a healthy goal, and I believe an achievable goal in the next 50 years. So for those of you who might be interested in seeing the article that I've been talking about, it's open access, so it's freely downloadable by everybody. It even manages to have a URL that can be written down in a human lifetime. Be aware that this is a 0, not an O, but it's and I hope it's not too difficult to read. It's still it's in an academic journal. It's written in academic prose, which is its own genre. But we tried to make it accessible to everybody, and I believe that the results are of interest. And as I said, the papers that we report on are all described in the bibliography, and so if there's anything that you want to follow up more closely, you can go and turn to the original article. So, thank you.